This is Eric from Fema Logistics. I want to thank everyone for taking a few minutes out of your time this morning to just hear a little bit more on the Ppe allocation framework that the Department of Health has been working on and is planning on implementing. For purposes of this morning's call, this is being recorded, and that is for the benefit of your counterparts that may not be able to be on the call this morning, and we will get it up on the hub at some point. Everyone is muted at this point. At the end, I'm going to say, for purposes today, if you have, because there's so many people on the call, if you would have a specific question as a result of the discussion today, please email that to me using the slogistics@pa.gov email address after the fact. So I'm going to turn this over to Andy Pickett from Pennsylvania Department of Health, from the Department Operations Center Incident Command, and let him lead on the discussion. So Andy, all yours.
Great, thank you, Eric, and I certainly want to put out my appreciation for Eric and his team at the Fema Logistics, who have been working hand in hand with our Department of Health logistics staff, but also certainly want to extend my appreciation to our county emergency management colleagues who have been going through these same issues with us for nearly a full year now. We activated our Department of Health Operations Center on January 27th, 2020. So I think we're going to start the planning for a birthday party real quick here. But in terms of things changing and moving as the situation evolves, as Eric said, we have been working to restructure our PPE allocation process. As I'm sure you're all aware, when it was very early in the response, our county emergency management partners processed over 3,000 requests for PPE and other services from the Department of Health. That number quickly became overwhelming, and we were unable to really do anything with that volume of requests. At which point in time, we switched it to a push model for PPE, where facilities that were having outbreaks, facilities that we heard about that were struggling, we would push an allocation of PPE to them. Now again, the landscape of the PPE supply chain has again changed. So we are again changing our protocols to go along with that. And what we are moving towards at this point in time is a modified pull strategy. What that means is that requests will be initiated by a facility, but in order to keep things fair and equitable, we are having established quantities of PPE based on the type and size of the facility. And this applies to the different PPE types. If you're looking at the WebEx screen, gloves, gowns, N95 or KN95 masks, surgical masks, face shields, and hand sanitizer will all fall under this modified pull strategy. I will say that this has not been widely released to the healthcare community. That announcement is happening this afternoon on our regularly scheduled statewide healthcare call at 1 o'clock, where we will again be sharing this information. Many of the long-term care facilities are aware of their component of this due to the transition from the RICP model to the RCAT model at the first of the year. But again, the broad distribution of this document to our healthcare partners is occurring at 1 p.m. today. So we wanted to just highlight some key elements for our emergency management community. First off, looking at the eligible facilities, certainly county and local first response agencies. That would include police, fire, EMS, but also county coroners and correctional facilities. As we pushed product out to the counties throughout the spring and summer, again, we will push an allocation to the county for use by all of those partners, and we would ask you, with your local relationships, to make sub-allocations out to those within your jurisdictions who need the product. There is also a note for county emergency management that backfill of product to other eligible partners would be authorized. I'll get into that a little bit more as we go throughout this presentation. Other healthcare partners that are eligible include acute care hospitals, long-term care and congregate care facilities. So that is the entire gamut of long-term care, congregate care, skilled nursing, personal care home, assisted living, drug and alcohol treatment facilities, intermediate care facilities. If it is licensed by the Department of Health, the Department of Human Services, DDAP, and we are also including lookalike facilities, so non-licensed facilities that meet those same or that perform those same kinds of duties are eligible under this process. And then the healthcare providers that are conducting public COVID-19 testing services. So if a FQHC is providing a mass testing event, they can request PPE for those purposes. We are not able to provide PPE to these provider types just because they need it for daily operations. I'll go into some of that eligibility here. Now talking about the FEMA requirements, and there are a couple of footnotes here just to provide some caveats. Certainly eligibility criteria. If we go through PPE a lot faster than we anticipate, we might have to restrict the eligibility criteria. Certainly if we are not receiving many requests at all, we might be able to broaden the eligibility criteria. We will certainly make sure all of our partners are aware if and when that happens. And then the eligibility within those facilities really comes from the FEMA September 1st guidance on eligibility for cost reimbursement. Because much of the product that we are pushing out now has either come directly from FEMA or has been purchased using Stafford Act reimbursement, we must follow the FEMA requirements. So that means that we should only be providing PPE to facilities that are unable to source their PPE through the normal supply chains, alternate supply providers, or mutual aid. And we're looking at those facilities that have less than a 7-day supply. That is what we are looking at as an urgent need. Certainly on a case-by-case basis, if a facility says, hey, I've got a commitment from my vendor, but that commitment isn't coming in for 2 weeks and I only have 3 days, we would certainly work to make sure that we can tide that facility over until their normal supply chain kicks in. But again, this is intended to be, for emergent, urgent needs, as outlined here. Certainly, the PPE also needs to be directly related to COVID-19 demand and patient care. A facility that isn't seeing any COVID patients would not be eligible for PPE under this process. And then PPE may not be used to backfill facility caches to provide elective or non-COVID related patient care or for any other unallowable purposes. Again, that's language that comes out of the FEMA guidance document. So what we are doing and would encourage our county emergency management partners to do as well, again, if you hear of needs from those types of facilities that would not be eligible under this program, direct them to the Department of Community and Economic Development's COVID-19 PPE and Supplies business-to-business portal. There are many different vendors that have product for sale. One of the biggest challenges we find is that many of these facilities just don't want to go through the hassle of negotiating a relationship with a new vendor. So if their primary vendor isn't available, they consider that a crisis when really they need to do some of that groundwork to find additional product through other sourcing means. So here's the part that is probably most relevant to this community here, the request process. So we have attempted to keep the request process as close to what our facility partners and what the emergency management community is already used to doing. And to demonstrate this, I'm actually going to go to the last page of the document where we have sort of a flow chart. So the initial, certainly we have someone who is in need, if that is a county government. So if you are putting in a request for your county government, you would submit a resource request form through the normal channels to PEMA Logistics, and then that would be shared with our Department of Health Logistics. If it is an acute care facility, a hospital, or one of those healthcare providers that are providing testing, the facility really should be working with their healthcare coalition to identify those other providers that might be available to them, identify additional supply chains, look at mutual aid, and have those conversations within the healthcare community. Certainly, if after those conversations there is still a defined need, that's when we would expect that the facility, and hopefully in conjunction with our healthcare coalition regional managers, would be reaching out to you at the county emergency management level. Again, submitting that resource request, providing that request to PEMA, who will then transfer to the Department of Health. Now, we understand that some of these requests are, they have waited until the absolute 11th hour. It might be coming in at, 5 p.m. on a Friday, when unfortunately our warehouse is closed on Saturday and Sunday, and this facility says, you know what, I just can't make it through until the Department of Health can ship me supplies. At that point in time, if you have county assets, whether it's a push that we have made to your county jurisdiction or something that you have gone and procured on your own, if you are able to fulfill that need immediately to the facility, you would then be able to put in a request to the department through PEMA saying, on such and such date, I filled this count or this eligible facility's request, I would like the backfill. That way it effectively turns into us as the department filling that request, just working through the county as an intermediary. So our county emergency management partners, if you are able to fill those emergent requests, you are eligible to then submit a request for backfill. Going back up to the facility having need, if it is a congregate care or what we used to call the RICP type facilities that were very much helped through the RICs, now through the RCATs, we are going to continue that process with those facilities. They have been working with the RICs and the RCATs, as well as the Department of Health staff who are in routine communication with them. So they will be provided the link to make the direct request to the Department of Health. So once we get all of these requests or any of these requests that come in, one of our evaluation criteria is, are we seeing a lot of repeat requests from a facility? That would just indicate to us that the facility is not applying appropriate conservation strategies. They're not using the PPE effectively. That would just mean that from a Department of Health side of things, we would want to have an outreach or communication with that facility in order to really emphasize the appropriate use and utilization of the PPE. But provided that they haven't put in, 3 requests in the last 3 weeks, we would certainly then go ahead and fulfill that request. And if we do fill the request, again, if it was an actual direct resource request form, either the hard copy or through WebEOC from a county, we would make sure that all the stakeholders on that form are notified. The requesting facility, the county EMA, our regional person from PHMC if possible, just so there is that uniform awareness. For the long-term care facilities, we're going to continue to post information on, or our PEMA colleagues are going to continue to post information on PPE that is sent out to them through the EM portal. If a request is denied, again, we're going to close the loop and make sure that all of the entities that are on that resource request form are aware. There are a couple footnotes here. There's one county in particular that has engaged their own program to support congregate care facilities. So we are just taking those requests and providing that to the county. There is some information here in this document. I won't go into too much detail. We are working extended hours at the Department of Health, but we do have limitations on when we can ship and when UPS is able to make deliveries. So just know that any request that comes in, you're looking at typically a 2 to 4 day time period before the facility would receive product. So just keep that in mind if your facilities are saying, oh, I don't have enough to last 4 days. Again, if you can front load that request and we'll backfill you, or certainly if you make a note that, hey, this might need to be a special case, we can certainly do those. Again, we try not to do we try to avoid one-offs as much as possible, but we certainly know that they do exist. Again, we need to make sure that the PPE we have in our warehouse is going to continue to last us through the rest of this pandemic. So we have some trigger points where, again, if a facility is requesting more than twice in a month, we're going to have that conversation with them, make sure they're utilizing it. And certainly if so many requests come in that we go through at 25% of what we have in the warehouse as of today, we're going to have to reevaluate what our criteria is and the quantities that we are pushing out. But again, if we receive so few requests, we might be able to open up eligibility, and we'll certainly make sure you all are aware of those changes. And the last key item on here is really the modified of the modified poll. So it is a request based by or made by a facility, but when they request or when a facility requests, there is a set quantity based on the facility type and size that they will receive. So we are able to keep things, fair and equitable. We don't have a facility that wants, 10,000 of something just because they want to have enough for the next, 12 months. That's not eligible under the FEMA requirements. So we are going to just ship the quantities that are listed in the chart in this document, again, based on the facility site type and size. So I know we've had a couple of questions. We put them into a frequently asked questions document. I believe that FAQ document was shared with you all. If we get additional questions based on these calls or our calls this afternoon with the healthcare community, the FAQs will certainly be updated and re-pushed out. We had a question come in on, batching of orders. Really, it is up to you at the county level whether you want to batch orders. Certainly, we're going to look at each request individually, and we will leave that to your prerogative to decide how you're going to manage the paperwork on your end. And if you are able to, or if you over a weekend have to front load 3 different facilities, one order for backfill that covers the quantity of PPE provided to all 3 of those facilities. As long as we know who those facilities are, we will certainly share that. If you at the county are providing PPE to a facility, the quantities listed here are sort of the maximum. So if a county were to happen to provide a surgical mask or surgical masks to a 150-bed skilled nursing facility, we would only backfill up to the quantity listed in this chart. The other item I will note is that does not need to be an all or nothing. Many facilities want all of the appropriate PPE, but if a facility has a single need for gloves or for gowns or for surgical masks or N95s, that can certainly be included in the resource request, and we will then just fill that product. If we don't hear anything, or if it doesn't notate anything specific in the resource request, we will likely just send all of it. But if there are specific needs, please notate that, and we will address that accordingly. I know there's also been a question about the coordination with the PHMC, the regional healthcare coalitions. So again, if it's an acute care facility or a FQHC primary care facility that is requesting, and you aren't sure if the facility has talked to their healthcare coalition, I would encourage you to reach back and say, hey, have you had these conversations? And then, just for our visibility, if you can put into the comments of the resource request who from PHMC has been engaged in those conversations, it helps us close the loop on the back end once we either approve or deny the request. So I think that's really the overview of this new framework. I know that Eric had indicated that if you have questions, please send them up to the PEMA logistics box, but we will certainly make sure that those questions get answered directly. And again, if they're common questions, then we will again add them to the FAQ document and re-push that document out so everyone has visibility. But that's what I have, Eric, so I will turn it back over to you.
All right, thanks, Andy. Andy, there is a question in the chat box. It's worded no resupply of XL sized, like extra large sized gloves. Do you want to address that now, or do you want to do that later?
I can address it in part now, and we might have to clarify that later. I know at the time that we were drafting this document, our supply of extra large gloves was limited, and we were primarily just pushing large, mediums, and smalls. I don't know if that is still the case, so I will have to work with our logistics team and see if this document needs updated to include extra large. Certainly, if there are updates made, again, we will ensure that all of our partners receive that updated copy.
Okay. I want to add two things. Andy, can you put the bottom of the flow chart up if possible, where it says about the notifications? I'm going to ask our counties to help us out with two things. If you do end up having to make a request, couple things to keep in mind. I know that over time, there's been sometimes concern over being able to receive larger quantities or skid loads of materials based on your particular facility. So what I would ask everyone to do is when you're doing your resource request, either on paper or within the web EOC system, to please fill in the delivery address that the materials should go to. We're still trying to work with the warehouse to determine what a skid, what a load of skids looks like versus what we would do UPS. I understand it's a little difficult for the warehouse because even amongst like gowns, the packaging size and the units per case varies widely. So we are trying to come up with that. If we believe that the delivery will be skids, we may even reach back to you just to confirm. But if, like I said, if you can put the delivery address, especially if it's for a larger push pack or what you believe would be a larger push pack, make sure it's someone that can handle the delivery. The other thing is, I know many of our counties are working virtual. So the delivery hours, if there is a known issue regarding you need to have somebody at the warehouse to receive it or at your facility, please throw that in the notes. That's going to be helpful to us. Unfortunately, we do not exercise control over the materials once they leave our facility, whether it's via UPS or via Pitt, Ohio, in terms of can they have the delivery there at 8 o'clock in the morning versus 4 o'clock in the afternoon. Now, one of the things we're going to try to do is if a delivery is going out, unfortunately, we do not get bill of lading / tracking data until very late in the day after hours. We're going to endeavor to the greatest extent possible, first to alert you that the materials are on the way, and that'll be a simple email that your shipment's on the way. The specific tracking data, if we can, we'll get it out in the evening. A more likely scenario is it will go out early in the morning to the email for the county and for the point of contact. Unfortunately, that's just limitations with the system as it is working now. So we're going to do the best we can with that. I expect we may have some hiccups initially till we get this up and running. And I ask you to please work with us. I also want to thank those counties who over the last couple weekends did jump in and help us with emergency resupply. And I know that the concerns you had, some of the counties did express a concern or two, especially in regards to a validated need. We're going to do our best we can working with the doc to make sure those needs are validated. It's just we unfortunately ran up against a weekend holiday and had very limited shipping options at the point we were made aware of the problem. So that is pretty much all I have at this point. Again, if you can please, any questions, any other questions, just let us know. We're going to try to get all this information up on the hub. That will probably occur early next week until the recordings and everything are processed. So, but we will try and get this up on the hub under ESF 7. The other thing I will remind all our county partners, on the ESF 7 GIS hub that we have for the counties, there is a copy of the running asset distribution list. That running asset distribution list is updated daily, Monday through Friday, and that shows you all the disbursements and shipments that have gone out of the warehouse to any county, state agency, whatever. It is a rather large file. There's I believe about 4,500 lines of data on it as of today. So you can filter and sort and all that, but that is also available to you. So if you would need that link that you either lost it or can't get into it, just email me and I'll sort that out with our GIS folks. So the document, I have a question. Okay, I apologize. The documents were attached to the email invitation, and if you did not receive them, what I will do is I will ask our 3 area offices when I get off the call to forward them out to the counties, again, just for your visibility. So other than that, I have nothing. Andy, any final closing comments?
Nothing further, just again, this is a tweak, and that's an opportunity for things to have that bumpy road. So like Eric, I appreciate the patience that you've had with us. And certainly if those issues crop up, email the logistics team and we'll take care of them. But thank you again for your continued partnership working with our healthcare partners and supporting our healthcare partners. That's all I have.
All right. Again, my thanks to everyone for jumping on the call today. Tried to keep this as brief as possible. We made it in 30 minutes. And again, any questions, don't hesitate to reach out. And with that, I'm going to close out the call and you can drop off. Thank you.